everybody. Okay, perfect. So Sophie's been sitting here for about 20 minutes with good numbing cream on.
Yes, lots of numbing.
So I'm going to zoom in.
So I don't feel anything.
These are the
That's
stretch
the goal.
marks. This is what we're trying to... How long have you had your stretch marks?
I noticed my stretch marks about, I'd say easily 10 or 11 years ago. It was right when I was graduating high school, because that's when I stopped dancing ballet.
Okay.
And my muscles changed. And I've been treatment for, I'd say, 8 years.
This is what a typical stretch mark looks like.
And
looks
Tanya
like
came to my
striated
rescue.
skin there. You can see that it's got markings here. I mean, this is a common thing. A lot of people have these. Women experience this with pregnancy. Teenagers can experience this with growth spurts. So it's pretty common, more common than you would think. But we do have a great solution to help treat this. So I'm going to give the phone to
Hey guys.
Sophie.
I'm going to flip you around. I've just been hanging out, watching the news, listening to music.
Perfect.
Hey guys, hanging out. Slightly nervous, but not too nervous because I did one side this morning.
Yes.
And it really wasn't too bad. It just felt more like a tickle, kind of slight, maybe like a rubber band, tiny little rubber band all over.
Yeah.
But I prepared this time, so may or may not have had a glass of wine for happy hour before coming. Now we're going to get started, flipping the camera around.
I'm going to show you guys what the microneedling looks like. So this is a pen that we use. I don't know if you guys can see, there's little tiny needles in there, about 9 needles. When I turn this on, it starts to oscillate. So it's very similar to anybody who's ever had a tattoo. Consider this like a tattoo device without any ink. And we're going to run this pen and sort of glide it over the tissue here to create some sort of a loving trauma, so to speak, so that we can stimulate new collagen, repair the stretch marks, make them heal. Now, this is not something that's going to go away with one session. You're going to have to do about 5 or 6 sessions, but you will notice steady progression over time. So, questions, I'm going to go ahead and get started. Feel free to.
There's my girl.
Ask. All right.
Thank you for saving me, Tanya.
You're
Finally,
welcome.
after 8 years for a remedy, I finally found one.
So the first thing I'm going to do is apply a peptide gel. This is so I can help glide the needles. Makes it a little bit more comfortable. And we're actually running out of this. We do a lot of these microneedling sessions, so.
Because they're so good.
It's a pretty popular treatment.
I'm very excited. This is the first time I've ever done microneedling is today. I approached Tanya, a couple weeks ago about my stretch marks, asking you what to do.
Yeah.
And I've been looking for a remedy for years upon years, and all of them just kind of freaked me out. They always made me nervous. There was a lot of peels and exfoliations that were going to take, over a year to fix. And then Tanya tells me that microneedling can help it between 5 to 6 sessions. So, here we go.
Get started.
Ooh.
Can you see that?
Hang on, I got your
So
gloves.
I'm literally
Sorry, guys.
tracing over. So each time that this machine treats the skin, the needles are penetrating up to almost 1,000 times. So there's going to be tiny little microscopic perforations that you can't see to the naked eye, but it's making tiny little holes in the skin, little areas of trauma. And then it starts this cascade of events with wound healing, and that's what repairs the tissue.
I'm trying to get the right angle, guys. It really just feels like a vibration and like a tickle almost on the skin. Like it feels like something's penetrating the skin, but it's not painful.
Good.
So it feels like something's working almost, but not too painful. Let me see if I can come
I had a patient,
around this side.
I had a patient of mine earlier today. We were doing a treatment, and she described it really well. She's like, it's almost like a really scratchy eraser that's coming in and erasing my stretch marks.
That's a great analogy.
Yeah, I have to give her credit for that. She was the best one to describe it, because it is hard to describe, but...
Yes,
so,
erase my
I don't
stretch
know
marks. I
if
like
you
that.
guys can see it's starting to get a little red, and that's what we're looking for. We call it confluent erythema, which is basically just diffuse redness over the area, and that's how we know we're actually penetrating. So I'm tracing these little stretch marks.
So what exactly is happening to my skin that's going to eliminate these stretch marks?
So the best way to describe it is almost like tiny little microscopic perforations that poke, these little holes in the skin, and that's what's going to create new tissue growth. So a stretch mark is really kind of like an old scar. There's things that you can do with fresh stretch marks. So if you start to get a stretch mark and you see it, it's really red, it's really irritating, it almost looks like a red marking on the skin. When they start to turn white, this is sort of at the end stage of a stretch mark, and it's much more difficult to treat this way. So if you can catch the stretch marks before they become too red, it's a lot easier to treat. We actually use one of our lasers here. It's called a pulse dye laser or a V-beam, and we use that for fresh, new stretch marks. So if you just had a baby and you've got some stretch marks on your belly or any other part of the body and they're relatively new, they're still nice and pink or even red, that we can treat much more easily with a laser. But if they're old, like you see here, and they've been here for several years,
are old.
yeah, if they've been here for several years, we kind of look at it like a scar.
Tanya, Michelle wants to know if this would work on brown skin or darker skin.
Yes, the thing that I love about this versus a laser is that I'm not introducing any heat. This is just basic needle penetration, so you're not going to have any heat or any, I guess, more of an issue with post-inflammatory hyperpigmentation, but this can be used on any skin type, from the lightest of skin to the darkest of skin. So you're not going to have any issue.
Great, so pretty much anybody can do this and between them will work. There's no
Yep.
worry.
Nope, no worry at all. You do give the tissue a little bit of a break. So this is something when you're doing sessions, I would recommend waiting at least 4 weeks before each treatment. In some cases, you can even wait even longer. So I'll have a few patients where we've done a session or two, they're starting to see some improvement. I'll make them wait a good 6 weeks because I want to give that tissue time to do what it is that I'm trying to get it to do, to repair, so I can start to see some improvements. I know how much deeper I can penetrate with my next session. So it's all very customizable.
Is there anything I need to do after the treatment? What should I expect afterwards? Do I need to be avoiding the sun?
Yes, sun avoidance is really key. You see the tissue's really red. You can see that there's actually some pinpoint bleeding here, which means we're getting good trauma to the tissue. That's just going to start the wound repair. And staying out of the sun is really ideal. I don't want you guys to end up getting any type of pigmentation changes afterwards.
So how long should I probably be staying out of the sun?
As long as the area is red. So that's going to be for maybe like a day or so.
Okay.
It actually feels, so Sophie, you're a really good one to kind of explain this. We did a treatment on her left side earlier this morning, which we'll show to you guys in a few minutes. I'm actually almost done.
It's really red now.
Really red. All right, so
It feels like a sunburn though. It's not too bad. But let me show you.
When I wipe this off, and I actually see a couple little areas right here that I want to go back over and give it another pass.
Really, it feels the way it looks, if that makes sense. It looks like a really bad sunburn.
Yeah.
And that's pretty much what the left side feels like right now. I don't feel much on the right side just because of the numbing cream, but after several hours on the left side, it just kind of feels like a sunburn, and it's more irritated to the touch as opposed to...
Yeah, and you guys can see how
consistent.
these stretch marks really start to pop out. The way that when I'm touching them, I feel them almost raised now, as opposed to depressed, which is how they felt to me earlier. So now they're kind of popping out. They're a little angry and upset at me, but that's exactly what I want. I want to see this new tissue growth. And so there's tiny little microscopic holes. Can you get really close?
Yeah.
I don't know if you guys can see. There's little tiny pinpoint bleeding, but nothing, to be concerned about. So now is the great time. I'm going to start to lather in some really great products that help with tissue repair, wound healing, just to kind of get this process going. But first I'm going to clean, the skin. This is a sterile water. Comes in a can. It's a really great spray. So I kind of like to use that to clean anything. I don't like to use water from the tap or anything like that. I want to make sure it's nice and sterile.
So basically what we're doing is creating new, young skin where my old stretch marks used to be.
Yep.
Is that a good way of saying it?
That's an
Because it
excellent
sounds
way.
glorious to me.
That sounds good to me. It's a lot easier than people think. I treat a lot of young girls.
That was really fast.
It's very fast. It takes longer for you to numb.
Yeah.
But I treat a lot of young girls, a lot of teenagers, a lot of college students that, you know, had a weight gain or a quick weight loss, and they're just dealing with stretch marks afterwards. And so now I'm going to apply.
My stretch marks came from 15 years of dancing ballet and then abruptly stopping and not staying in shape the way I maybe should have at the time.
You know what? I think everybody has
my
some
body
stretch
changed,
marks
my
somewhere.
legs grew, and you know, things happen with age.
I'm rubbing in a copper cream right now. This helps with wound healing, wound repair. Takes the sting out, takes the burn out, feels a lot better. And that is it. We have completed.
That's it?
That's it. We've completed our microneedling. Do you guys?
That was really fast
outside?
and easy and painless, and I only have to do this, what, 5 times? And my stretch marks are going to be better?
We'll kind of gauge
Golden.
it. Usually I tell everybody
Sold.
plan on 6, but it could be less than that. We'll see.
Even if it's 6, that's not so bad.
Yeah.
All right, guys, I'm going to pass it over to Tanya so we can show you what the other side looks like after a few hours.
So I'm going to let her flip over so you guys can see the other side that we did, was what, 8:30 or 9 o'clock this morning? So this is how the area looks. You can see those stretch marks are really red.
They're raised and red, and it,
Yep.
I mean, it really does
Feel like a sunburn?
feel like a sunburn. It looks like a sunburn. It feels like a sunburn. It's irritated it irritates if I touch it, but if I don't touch it, it's not really bothering me. It's just kind of sitting there red. And it's in an area that I'm not really sitting on this area. It doesn't really get bothered very much. So
Perfect. Excellent.
It's an easy treatment.
This will actually, some of you might be wondering, this will go away within about 24, 48 hours. So it doesn't stay like this. This is a treatment that you could do in the beginning of the week and then not worry about wearing something like a bikini over the weekend. So it's pretty simple to do. I'm going to see her back for her next treatment in about maybe 4 to 6 weeks. And we're going to keep posting this live so that you guys can see the progression as we go.
Oh, we will keep you guys posted. I am all about showing you my eliminated stretch marks once they're gone.
Absolutely.
I'm very excited. Thank you, Tanya.
You're welcome. We also have a video on YouTube that we just posted, so if you want to see me treating someone on the face, on the neck, there's a lot of fun areas that you can do with microneedling. And if you have
Microneedling
questions,
does a lot more than just stretch marks.
It does. It helps with pigmentation. It helps with wrinkles, age spots. There's so many things that we can do with this because we're repairing the actual tissue. Thanks, guys.
Thanks, guys. Bye.